Hello, my name's Dr. Khalid Mushtaq. I'm a dentist working for NHS Haywood, Middleton and Rochdale. I'm also a teacher and an inspector for the General Dental Council. I'm going to briefly talk about the health consequences of using tobacco. Let's look at cancer first. Smoking tobacco is the single biggest cause of cancer in the world. Smoking causes many types of cancer, for example, lung, kidney, bladder, stomach, mouth, many cancers. Chewing tobacco can also cause cancer, including mouth cancer. Stroke and heart attack is also a consequence of using tobacco. Nicotine in tobacco causes increased blood pressure, increased pulse rate, also decreased blood supply, which in turn increases the risk of stroke and heart attack. A pregnant smoker is at a higher risk of having a baby born prematurely and with a low birth weight. A woman who smokes during or even after pregnancy increases her child's risk of cot death. I'm just going to talk about oral cancer specifically now for a moment. Oral or mouth cancer commonly involves the areas of the lips or tongue. It may also occur underneath the tongue, the cheek lining, the gums or the palate. These can be malignant and spread rapidly. Smoking kills around 114,000 people in the UK each year. Of these fatalities, about 46,000 are from smoking-related cancers. Smoking and other forms of tobacco use are associated with 70 to 80% of oral cancer cases. Oral cancer causes around 1,700 fatalities in the UK every year. Alarmingly, tobacco use in some Asian communities is much higher than the UK average. There is a concern that rates of oral cancer may mimic much higher rates found in India and Pakistan. The number of deaths caused by smoking in India is expected to exceed 1 million per year, every year, if something's not done. Oral cancer is very difficult to treat successfully unless it is caught very early. Your dentist is in the best position to detect early signs of cancer. Now let's look at some signs and symptoms of oral cancer. Oral cancer can mimic symptoms from other more common and less serious diseases, so it's very important that we're aware of these symptoms, especially if you use tobacco. The best way to ensure you don't develop any problems is to stop using tobacco. Your dentist will be in the best position to check your mouth for any possible signs of oral cancer. The common symptoms of oral cancer are 1. An ulcer in your mouth which hasn't healed within 2 weeks. 2. A lump inside your mouth or in your neck that hasn't responded to other treatment. 3. Difficulty in swallowing that has not responded to other treatment. 4. Red or red and white patches inside your mouth which have persisted for several weeks. If you are concerned, make an appointment to see your dentist. Well, let's look at some tips for quitting. Try not to take up the habit of smoking or chewing tobacco in the first place if possible. If you are quitting by yourself, it is recommended that you stop completely on your quit date. Stop smoking groups are a great way to take the first step towards giving up. You'll get support and advice. Remember, your health will improve as soon as you stop smoking or chewing tobacco. And a regular visit to your dentist will be reassuring. On the screen you can see some contact numbers and websites for further information.